All right. So, all right, I think we're straight now. Welcome, everybody. I'm Dr. Peets Talbot, one of the co-founders at Ocean Rock Wellness. And I am going to be talking to you guys about functional medicine today and what really functional medicine is. I understand that we had a good bit of people register, and though some people were working, we're planning to watch this once they finish. So I'm excited to have everybody here, and also for the people who are going to be watching it in the near future. I want to be also able to answer some questions for you guys. So if at any time you have a question, just type it into for me, and what I'll do is I'll definitely, if I don't answer it during the presentation, I'll answer it afterwards. So depending on how we're making for time. So let's, I think I still heard somebody's background. I don't know. Yeah. So Dr. Bame's going to help me figure that out. But essentially, I want to kind of keep on moving. So defining health. What I want you guys to do for me is answer me one question, and you can type your answer into the group chat. But let me know if you would consider yourself healthy. Do you believe that you are in good health right now? Do you consider yourself healthy? I'm very interested in knowing this question because when I started on my functional medicine path, and I didn't think I was really started on my functional medicine path, one of the big things that was a big roadblock was for me in figuring out that something was even an issue with me is I always thought I was healthy. Nobody can ever tell me that I was not in good health. And this was when I was in my 20s, and I was all through medical school. I thought I was pretty much a perfect picture of health. I had only been to the hospital once, and that was to get stitches. But otherwise than that, my doctor appointments were few and far between. I was a picture of health. But what made me think that I wasn't as healthy as I thought I was when I was trying to have kids. And that came about after about 3 years of trying to have kids and realizing that I couldn't have kids, and I had some miscarriages in that. And so why would a healthy person have those issues if they're healthy? And so that was a really big wake-up call for me that I wasn't as healthy as I thought I had been. But what was also kind of a big wake-up call was during that period, I had these aches and pains, particularly at night. And I was starting to not be able to sleep very well. So, because particularly these cramping and these aches and pains were coming to me at night. And when I would ask, my colleagues or my other doctor friends, like what was going on, they didn't really think of anything. And, and of course, blood work and everything was normal. Everything was coming back normal. All the labs that everybody was getting was all, normal. So I wouldn't think that I wouldn't be healthy, But when I came back and I started to practice, and this is after doing all my studies to become a medical doctor, I actually was very tired and dealing with a lot of leg pains. And, sometimes to the point where I didn't even really want to go into work, but I was just like, I did all this training to be a doctor. I need to show up for work. And so, but I really, truly, honestly, when I think back that a lot of times I really forced myself to kind of go in. And so the reason why I ask people to define, and ask if they're healthy is I see a lot of people who come into my office and I ask them about their health, and they say they're absolutely in great health and they're in good health. And then when I delve a little bit further, they've got all these symptoms going on, or they're on medications, and I'm just like, well, you know, so I think our definitions of health are different. I think, you know, some people define health just probably being free of cancer or free of a bad illness or something like that. So, alrighty. So let's talk about, you know, what we can consider as things that determine your health. So when it comes to I think the status of your health, I think you should think of like 4 different factors. Your health behavior, and that's more like your lifestyle, what you're eating, what type of exercise you're doing, what's your sleep habits like, do you smoke, do you drink. These are the sort of things that you think about when you think about what your health behavior is. The next determinant of health is what your physical environment is. And this is the one that nobody, I think, puts on the radar until, say, maybe I will bring this to attention, is where are you living? What does work look like? Where are you playing? Are you exposed to mold? Is it a lot of noise in that area? Is it dust? Is it an old house? Does it have old layer paint? And the reason why I say this is because the type of medicine that functional medicine is we look at all of these things that come up in people's physical environment. So I'll just say that just the other day, I had a woman who came into my office, and she has been battling with issues with fatigue, will consider herself in really good health because she's not on any prescription medications, but definitely having these issues with fatigue. And when we did her labs, we found that she had high levels of lead, and likely probably picked up that lead from maybe old lead paint, maybe it was like you know, exposures from wherever building she was in or house she was in, you know, in her younger years. So physical environment is really important to determine the quality of your health. And could you imagine being in a house that is riddled with mold? Some people will tolerate mold well in a house. It's not everybody, but some people can make that really sick. And I have another client who mold was a big issue for her at work. And so physical environment can play a big part in your health. Heredity. So heredity is your genetics, you know, the genes that you get passed on. And sometimes people give this maybe too much credit, but there's also, you know, it's also part of what makes you healthy is because you obviously, you know, your genes do influence things, and this is what gets passed on from your parents. But I always say that heredity is almost like having a loaded gun, okay? And it's usually the health behavior, physical environment that actually pull the trigger, but you know, depending on what type of genes you do get from your parents, that also influences your health. And then the last thing will be your access to health services. And you know, this can mean access to health insurance, and it can also mean access to finances to pay for your health. And so what we see is that obviously people have really good health insurance and who have really good financial means to pay for things that they need for their health will actually generally be in a more better health state than people who don't. And so those are, I would say, the 4 determinants of health. Let's talk about now disease of lifestyle. Now, in our book, and this is pretty much in our first chapter. So if you guys don't have, if you guys can see this, this is our book, Healing Bermuda, and in chapter 1, which is the chapter on what's the crisis, we talk about this pretty extensively, and so this is something good to read. And if you don't have it as an ebook, we give it away as a free ebook. Go to healingbermudabook.com and thehealingbermudabook.com and pick up that. So you can just download that for free. But essentially, I'll summarize it is that in today, so currently, what is affecting our health now and what people are essentially dying of is not what we used to die of. So 50, 60, 70, 80, and farther years ago, we used to die mostly of infections. And so that could be tuberculosis, that could be, in Africa, HIV became a big cause of death and morbidity there. But now what's kind of amazing about these statistics is that by 2030, the biggest killer in Africa, what's not going to be the biggest killer in Africa from the statistics from the CDC is not infections, but diseases related to lifestyle. So high blood pressure, obesity, cardiac issues like heart attacks, strokes, and those sorts of things. And so that's, we're close to 2020. So that's 11 years away that, we're going to have now be more dying of lifestyle issues and things like that than the infections that we used to die of later. So that's very, very interesting, okay? So, functional medicine versus conventional medicine. And why I think this is really important for people to understand is because I think people get conventional medicine is what the, stereotypical doctor experience is, but, and there is some similarities. So, functional medicine functional medicine, just like conventional medicine, is going to have still licensed medical professionals who are doing it. It still uses the basis of scientifically proven therapies, and they will still do diagnostic tests. And I think those are some big. And also there is uses for prescription medications, even in functional medicine. I think sometimes people think that because one of my big mantras is to actually get people off of toxic prescription medications, they think that I don't use any prescription medication. And that's really not the truth. I think now with my functional medicine training and background, I understand which medications are good to use, and which ones are probably not good to use, and which ones are like in the sense that you can use them maybe for a short time, and which ones that you would really just want to try to avoid completely if you can. That is that. So so how I would say functional medicine and conventional medicine differ is that functional medicine is more health related, okay? Conventional medicine is more disease related. And what that means is functional medicine is all about health promotion. It's great that, sometimes people think, oh, they have to be uberly sick to come see me. And that's really, really not the case. The best is to come and see me when you think that, your health is pretty good or you're in good health and you essentially want to optimize your health. And one of the functional medicine doctors that I follow, he says people should think of it as like this, is that, you don't go into open a business or start a business to go bankrupt. You start a business to make a profit. And so that's kind of how you should look at functional medicine. Functional medicine is meant to keep you in a healthy state rather than, trying to keep you in a disease state. So another thing that functional medicine is, it's patient-centered. I find that, and especially if I'm dealing with kids, it's patient and family-centered. And it's not essentially a doctor-centered approach. And that means is that you have to kind of, have complete buy-in from the patient. You have to listen to the patient. You have to collect a lot of history from the patient. So you're spending a lot of time, you know, with your patients and really kind of getting to know them and to know what challenges they have. So it's not all about, you know, I'm the doctor, this is what you need to do, and this is what I'm saying. And, you know, you're in and out of your visits within, I don't know, say 15 minutes. It's holistic. And functional medicine is holistic. I would say conventional medicine is more specialized care. So, you know, conventional medicine has gotten to the point where, you know, you have doctors who only look at the brain, and you have doctors who only look at the heart, and doctors who only look at the lungs, and you have doctors that only look at the kidneys, and then you have doctors who only deal with say rheumatological issues, so it could be joints and things like that. So it's very specialized, conventional medicine. Functional medicine looks at the whole individual, the whole person, the whole body, and sees how everything is connected. And because of the holistic approach, they might also bring in more integrated therapies because of that. And then functional medicine is also more focused on prevention, which means catching things as early as you can or completely preventing them. So using tests that are designed to look at for the early signs of, say, diabetes, or the early signs of cancer, or, you know, those sorts of things before it even becomes an issue, instead of focusing on disease detection. And so conventional medicine and a lot of conventional tests are only meant to you know, look for a specific diagnosis. And so if you don't have diabetes, then they're like, okay, everything is normal. And if you don't see any cancer, then everything is normal, but not really looking for those early signs to help you to prevent it, if that makes sense. So the role of conventional medicine, I feel like the role of conventional medicine, just because of that, is now becoming really, really important, because now we're having so much people have more diseases related to lifestyle and their environment. And this whole approach is looking at more depths of evaluation, managing, and preventing these chronic diseases that we're seeing more and more. And it's also important to note that conventional medicine does not, you know, reject functional medicine does not reject conventional medicine. Conventional medicine truly is kind of, you know, the foundation of functional medicine. I think my conventional medicine training really helped me when I was learning functional medicine to build upon that. So that's great. So there are, I would say, 3 pillars of functional medicine that should be really clear to you guys, is that functional medicine is patient-centered care. So patients and their families are supported in a meaningful way to them, okay, to the individual patient. It's also integrative and science-based methodology. So I would say probably every therapy that I recommend has science behind it, and it's a lot out there now to kind of catch up on. Just a couple of weeks ago, and I would say for the last few months, I've been focusing you know, my research time and my study time to learning about, you know, the cannabinoids, which is CBD, and understanding what now, how that can benefit. And, you know, now seeing all the research and everything behind it makes me, you know, really more comfortable with, you know, using my medical research and my clinical expertise to kind of direct that and incorporate that now into, you know, my methodology. And so that's just one example, but, you know, because that's something more recent for me. But, you know, it's all about science-based methodology, integrated science-based methodology. And a lot of times, you know, you'll kind of go to somebody and they will, you know, maybe another doctor might not have that training, and they may feel like they don't want to go ahead and advise, or they would think that there isn't much science around herbal remedies and things like that. But you know, you'll be surprised that there is, and functional medicine doctors are trained in that. The last thing would be the integration, and this is kind of leading into that. The last pillar I would say is integrating the best medical practices from multiple disciplines. And, you know, I'm classic for that in the sense of my day-to-day. You know, I might use homeopathy, I might use natural remedies, I might use herbal remedies, I might use prescription medications. I talk a lot about nutrition, exercise, lifestyle management. So what you're doing is you're taking, you know, when you're functional medicine will look at this individual client and see, okay, what do they need to support their body? And maybe the answer is, you know, they need this nutrition, diet, and lifestyle changes. And what maybe will really help them is maybe they need this vitamin or mineral support, or maybe they need these Chinese herbs, or maybe they, you know, need this homeopathy remedy. It could be a whole gamut of things. So let's see. Dr. Famous is just saying to change my screen size a little bit. So let me see how I could do that. I don't know how. Okay, all right, so make my screen a little bit bigger for you guys. All righty. That better? I think I did that. Okay, all righty. So the functional medicine approach to disease. So the idea is that we look at different core issues. One of those is that one of the things that we do for functional medicine is that, like I said, prevention is really, really big when it comes to, and it's not to say that people shouldn't come to a functional medicine practitioner when they have a diagnosis, but the earlier you come to a functional medicine practitioner, it really is the best. And I guess there's, like, you know, a couple of things with functional medicine. One rings true really well for me because it's something that my grandfather always did, which was, you know, prevention is better than cure. But the other one is that, you know, also an ounce of prevention is better than a pound of cure. So it's all about, you know, early detection, like, you know, really looking at, you know, the earliest signs of anything popping up and really solving things from that there. Alrighty. So the next thing will be, let's talk about, you know, systemic diseases and what that is, because a lot of people really don't have this terminology on your radar, but I think it's really important too. So systemic diseases are a big area that, you know, functional doctors focus on, and these mean that these are conditions that focus on the whole body, and they can be anything from arthritis, cancer, chronic fatigue syndrome, diabetes will be considered a systemic disease, high cholesterol, hypertension, autoimmune conditions such as lupus, all of those are systemic diseases. What functional medicine doctors do is we look for the root causes of these diseases, essentially, and what could be triggering them. So some of the things that we figure is a root cause issue is something like inflammation, improper sleeping, poor diet, stress, immune imbalances, trauma, you know, some sort of significant life trauma, negative thought patterns, so mindset, that's a big, huge issue. You might think that, you might not, some people don't think that that is a root cause, but I have people who have walked in and sat in a consultation chair and particularly feel like they're going to have a disease because their mom got it and their grandma got it, particularly when it comes around breast cancer and things like that, that would be a significant one, because I had a lady who came in, you know, really with that belief that, everybody in my family's had breast cancer, I'm going to have breast cancer. So that's a negative thought pattern. And remember, I just said, genetics is just part of it. Genetics just means load in the gun. It doesn't mean it's gonna, it doesn't mean that that's gonna go off. That bullet has to be released in a sense. But and I guess another one of the things that I have negative thought patterns is I see a lot of negative thought patterns when a person is coming to me to address weight issues. Sometimes they have the belief that I've always been this weight. I've always had issues with weight, so I'm always going to have an unhealthy weight if that's a thing. I've always been tired. So I've heard people say when they come in to see me. So negative thought patterns definitely will be a root cause issue, and we have to kind of stamp out that, and we have to make sure that the whole mindset is really engaged in a healthy and positive thought pattern. So lack of regular exercise is another big thing. Digestive problems could be a root cause, and toxin exposures. Really, really, really big issue that we're seeing now for kids and even for adults. So common concerns that usually bring people in to see a functional medicine doctor will be anything from allergies and eczema to depression, cancer, obesity, irritable bowel syndrome, very common, arthritis, and there's several types of arthritis, but usually some sort of pain issue. Heart disease, could be high cholesterol, could be stroke, could have had a heart attack, could have had an irregular rhythm, see lots of that. Seeing lots of anxiety, and this could sometimes be new onset of anxiety or long-standing anxiety. That's common concern that people have. I mentioned high blood pressure already. Autoimmune issues, lupus would be one. You have autoimmune thyroid issues. Sometimes people don't know, or ulcerative colitis, see a lot of that. Fibromyalgia, so that's a pain issue, or just chronic pain in general. So, people, would have dealt with pain for usually more than a few months, and sometimes have been dealing with pain for years when they come in to see us. So what to expect? When you are visiting a functional medicine doctor for the first time, you should expect to spend a lot more time with them, and usually generally in the first couple of visits, and that could be anywhere between 60 and 90 minutes, and some functional medicine doctors will also have you fill out a pretty detailed history, and that's all essentially to make sure that they're getting to know you in a more detailed and thorough way. And they're trained to listen. So in a functional medicine consultation, expect that you will actually do most of the talking, and I or Dr. Famous, who we do the listening, and we will generally, like, my habit is to type, and because I'm really making sure that I'm really listening to you, and that helps me to listen to you. Yeah, the idea is to give as much of a detailed account of your health and lifestyle, your environment, and what issues have been going on with you as much as possible. And as you're talking and as you're getting a history, it's helping us to figure out what could be the root causes of the issues that you're dealing with. Functional medicine doctors like to get all up in your business, all right? So that's just what you should expect. I know I had one client who came And you know, she was referred from another doctor, and that time I was definitely spending more time with clients. And you know, I started to ask her a little bit about her social life and her fiance and where she was from. And she really, you know, really kind of wasn't expecting that. And it made me very conscious that, you know, it's really good to tell people that you're really going to get all up in their business so they don't feel so off put. But that's one thing you really should expect if you're definitely going to see a functional medicine doctor. The core systems that functional medicine, you know, there's a few things. I would say there are 6 things that functional medicine likes to take into account. And, you know, these areas are going to be sussed out at some point during your visit with a functional medicine. One is pretty much the optimization of your nutrition. And this could look like anything for anybody. Functional medicine doctors are more into giving a more personalized meal plan rather than saying, okay, well, go eat certain way. Usually, if it is, say, oh, maybe a paleo would be good for you, it maybe is probably a paleo with a twist, you know, just makes it a little bit more good to you. Balancing hormones is a big trigger, and this is an issue for men and women, but this is something that the functional medicine doctor will go over with you. It's really important, especially in our older years, to make sure that you're having a good balance of your hormones. But, and I want to, you know, hazard it, because you guys know that I do see kids all the way up to adults, is that I can start to even see some early hormonal issues, even with kids, that, you know, I have to work out as far as balancing, and that would be like my middle schoolers generally ongoing. Inflammation in the body, that's a big core system and a big core issue that we see. So we'll talk a lot about, you know, generally you have to kind of fix some sort of inflammation in people's bodies. Gut health is another thing. So, you know, don't be off-put if, you know, the functional medicine doctor is talking to you about, you know, your stool patterns, bloating, and things like that. You know, that's really important to figure out what's going on. The last one would be detoxification. Again, that also plays into like your pooping patterns, but also, you know, your urination patterns, and also how often you're sweating and things like that, and what toxins your body is getting exposed to. And the last thing would be a calm mind. So we have so much stress in our lives. I would say now in today's world than we ever really did before. And so it's really important that, you know, if we're going to make a really good holistic and integrated plan to getting your health back on track, that we make sure that we're incorporating how to have a calm mind. So functional medicine, you know, essentially in a lot of ways can be the future of where medicine is getting. There's probably definitely not enough functional medicine, but I think as, you know, the culture kind of the health culture starts to take a shift, and even the medical culture starts to take a shift, you're going to see functional medicine becoming more and more available. But, you know, there are a lot of functional medicine doctors still out there, even though it's an up and coming field. So the summary that I would leave you guys with is that we have talked about functional medicine, what functional medicine is, that it's a whole body diagnosis approach that, you know, tries to look at disease and at the earliest stage or prevent it, and then going on to more of a holistic treatment plan. And that means by treating the root cause, using natural treatments with fewer adverse side effects, scientifically proven treatments, alternative medical practices, so that might be using Chinese herbs, homeopathy, those sorts of things. Also using more advanced diagnostic testing, and that's to make sure that you're picking up the body, you know, as you can see it moving towards a disease state, not when it's already in that disease state, okay? And so you're making sure that you're preventing chronic health issues. Alrighty. So that is essentially the bottom line. This is where you guys can feel free to ask me any questions that you may have, or anything that have come out. And I've given a lot of information, so I know that it could be a lot to process, and some of it it needs to just sink in, which is fine and fair. And then you may find that you might have questions later, and you just send them our way. So this is our resource list. So this is a list of resources from the presentation. So about our questions is Dr. Famous was just saying that Facebook is a really good way to contact us. So if you haven't liked us on Facebook, like us on Facebook, but you can always private message us as well, and send us your questions if they come up after this presentation. So I want to say a big thank you very much. It was a pleasure to give you this presentation on functional medicine. Hopefully you guys learned something. Hopefully I may have cleared up what functional medicine is, what it is not, and how it can possibly help you or a family member optimize their health. You can send me any feedback. This was the first time that we've done this, and I know that we're gonna have to kind of learn it a little bit more, but what's also really helpful for me is for you guys to give me an idea about what type of things that you would like me to talk about, and it could be anything about I would say like natural ways to boost your energy, or how to deal with sugar cravings, or maybe sleep issues. I definitely welcome the suggestions, because I want to make sure that the information that I'm putting out there and these presentations that I'm doing are going to help to serve you and to improve your health, and help you to optimize your health the best way you can. Alrighty, bye.
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 Bye.